I always eat right, and I do lots of exercises. I run. In the winter when I can't run, I work out, and I don't sit still. You know, I've always tried to take care of myself, and I just never thought that, you know, somebody that would take that good of care of themselves would, you know, have a heart attack. Just something I didn't even imagine would happen to me. We would have tried to go any further that I would have even survived. So if we would have tried to go out of town, even to Buchanan, there's no way I wouldn't have made it.
Well, I've been here 20 years. We went through one expansion. It was a wonderful thing. And now, after 20 years of being in the same emergency department, we need to expand the facilities that we have so that we can do a much better job in providing quality emergency care to the county and the people in the surrounding areas. We serve about 85,000 people in the surrounding areas in 5 counties, and so it's a very busy, small rural emergency department, and we need to grow so that we can better serve the communities that we take care of.
I've been a nurse in the emergency department for 20 years. Actually, I started here whenever the department was just redesigned and new. Since then, we've seen about 500,000 patients through this emergency department if you run the historical data on that. That's a lot of patients. We have a 15-bed ER. That being said, there's not a lot of privacy for the nurses to do their documentation. It's not an ideal situation for them to work in there, standing at computers, and there's not enough counter space. The other thing, as far as the new emergency department goes, we have an open floor plan in here, and in the past that's been a design for emergency departments. Now with HIPAA, privacy is something that a lot of facilities are going towards, and infection control. Whenever you have individual patient rooms, it's much easier to maintain good infection control measures.
The current emergency department is 20 years old. It's had 500,000 to 600,000 visits go through that emergency department. It is showing its age at this point in time. Healthcare has changed over the last 20 years, and we try to be more convenient, comfortable, privacy for the patients, and we want to make sure the community has those features available in the emergency department. We live in a rural area. We want people to come and visit this area, to live in this area, but we also want them to know that if something happens, we're going to be here 24/7. Every day of the year, we are here to take care of the patients.
We absolutely treat the majority of our patients here. You know, there are a few specialties that, you know, we do send away for, but most of our patients are treated here on site.
We are a community health facility. This is the community's hospital. It's important the community take ownership, and they have. And they'll continue to have the opportunity with this campaign to make the new ED department, you know, their ED department.
With the addition of more beds and new equipment, we would be able to handle a larger volume of patients in a quicker period of time, and that's always in everybody's best interest.
With Fast Track coming through, we have a lot of patients that come in for headaches, you know, not really in an emergency type of situation. And this Fast Track is going to be very quick, you know, get them in, get them out. And you're not going to have all that weight you're going to have in the emergency room that we have right now because we have limited space.
You know, the hospital is really more than a medical facility. It's really an economic development tool for the entire community because, you know, when people think about moving to an area or a major company thinks about expanding or building a new plant, you know, the medical service and the education system are two of the first things they look at. So we're a very integral part of the community.
I think it's a tremendous economical boost to the community. We may not recognize that and see that all the thing, but working with some numbers all my time and in the business, I can see how important this really is.
You know, a $2 million vision is huge. It's huge for Davis Health System, it's huge for this community, it's huge for any community. It's not just a few contributions, no matter how large, that can achieve that. It's everybody coming together as community and giving at the level they can. I think the opportunity with the new campaign is for all of us to stop and think about how can we be a part of it. And if that's continue giving at a level that I've already been giving, that is wonderful. If it's an opportunity to do more, and I have the ability to do more, that's wonderful. If life circumstances have changed and I can't do quite as much, every dollar is important. Together, collectively, we're going to be able to do a lot to transform emergency care.
This is a small town, and small town people stick together. We want our town to be the best town in the world, and it's just like this hospital. We want this hospital to be the best. This is us. I mean, this hospital is us. We make up this hospital. And we are part of the hospital, part of the community. We come here as patients, not just as employees. And we want this hospital to be the best there is and the best that can be. And the fundraisers we have, everyone wants it, to succeed in giving. So it can be, as I said, the best there is.
I think as we drive through town or through our community, we point out that's the church where my piano recital was when I was a kid, or that's the playground where I played Little League. And for folks to be able to drive by and say, I remember when we helped build a new emergency department, or I remember when there wasn't a Davis House to serve patients and families. I think there's great pride in that, and it just becomes sort of one of your family stories that we're in this together.